Hey future nurses, welcome back to the channel. Today we're diving into perfusion, the lifeline of every tissue and organ in the body. If you master perfusion, you can literally save lives. Let's get started. So, what exactly is perfusion? Perfusion is the delivery of oxygenated blood to tissues and organs. Without good perfusion, cells die. Plain and simple. It's your job to recognize issues early and act fast. Quick tip, always think, is the blood flow strong and effective? Now, let's talk about the major conditions that can wreck perfusion and how you, as a nurse, can intervene. First up, atherosclerosis and hyperlipidemia. Artery blockages slow blood flow. Top interventions: promote lipid-lowering meds like statins, encourage diet and exercise changes, and monitor for chest pain, also known as angina. Next, hypertension and hypertensive crisis. High blood pressure damages vessels. Your go-to interventions: administer antihypertensives, monitor BP closely, educate on a low-sodium diet, and manage hypertensive emergencies urgently, especially in pregnancy. Shock and hypotension, blood flow to organs drops dangerously low. Administer IV fluids or blood, monitor vitals closely, and use vasopressors if ordered. For myocardial infarction or heart attack, where heart muscle dies from lack of blood, administer MONA, that's morphine, oxygen, nitroglycerin, and aspirin. Prep for PCI or CABG and monitor EKGs. Arrhythmias like AFib, VTAC, VFib, asystole, and bradycardia disrupt pumping. Interventions include administering antiarrhythmic meds, monitoring cardiac rhythm, and preparing for cardioversion, defibrillation, or pacing if needed. Heart failure and cardiomyopathy mean the heart can't pump effectively. Manage fluids with diuretics, monitor weights and lung sounds, and teach medication adherence for drugs like ACE inhibitors and beta blockers. Peripheral vascular disease decreases blood flow to limbs. Encourage walking, promote foot care, monitor for ulcers, and prep for strategies to prevent amputation. Chronic poor perfusion leads to venous and arterial ulcers, osteomyelitis, and potential amputation. Your interventions: wound care, infection control, and referrals for vascular surgery when needed. Valve disorders like aortic or mitral issues mean valves don't open or close properly. Monitor for heart murmurs, manage heart failure symptoms, and prep for valve repair or replacement. Deep vein, thrombosis, and pulmonary embolism involve blood clots blocking vessels. Administer anticoagulants, use compression devices, and promote early mobility post-surgery. Congenital heart defects like VSD and others are structural heart problems from birth. Monitor for signs of heart failure in infants, support surgical interventions, and educate families on care needs. When assessing perfusion, look at blood pressure and heart rate, skin color and temperature, capillary refill time, which should be less than 2 seconds, level of consciousness, and urine output. Tip: cool, clammy skin and altered mental status are big warning signs of poor perfusion. Perfusion is everything. The faster you spot problems, the faster you save lives. Keep studying, keep practicing, and trust your instincts. Download your free perfusion nursing PDF in the description. If you found this video helpful, smash that like button, subscribe, and hit the bell so you don't miss any future lessons.